Hypertension is a typical condition where the drawn-out power of the blood against your artery wall is sufficiently high that it might in the end cause some medical issues, like coronary illness. Circulatory strain is resolved both by the measure of blood your heart siphons and the measure of protection from bloodstream in your supply routes. The more blood your heart siphons and the smaller your veins, the higher your pulse. A pulse perusing is given in millimeters of mercury, mHg. It has two numbers. Top number, systolic pressing factor. The first, or upper, number estimates the pressing factor in your veins when your heart beats. Base number, diastolic pressing factor. The second, or lower, number estimates the pressing factor in your corridors between beats. You can have hypertension for quite a long time with no manifestations. Uncontrolled hypertension builds your danger of genuine medical issues, including cardiovascular failure and stroke. Luckily, hypertension can be effectively distinguished. Furthermore, when you realize you have hypertension, you can work with your primary care physician to control it. Side effects. The vast majority with hypertension have no signs or indications, regardless of whether circulatory strain readings arrive at hazardously significant levels. A couple of individuals with hypertension may have migraines, windedness or nosebleeds, yet these signs and indications aren't explicit and ordinarily don't happen until hypertension has arrived at an extreme or hazardous stage. When to see a specialist. You'll probably have your blood pressure taken as a component of a standard physical checkup. Ask your primary care physician for a pulse perusing no less than at regular intervals beginning at age 18. In case you're age 40 or more established, or you're 18 to 39 with a high danger of hypertension, ask your primary care physician for a circulatory strain per year. Circulatory strain for the most part ought to be checked in the two arms to decide whether there's a distinction. It's essential to utilize a proper measured arm sleeve. Your primary care physician will probably suggest more incessant readings given that you've effectively been determined to have hypertension or have other danger factors for cardiovascular infection. Kids age 3 and more seasoned will generally have blood pressure estimated as a piece of their yearly tests. Contingent upon that you don't routinely see your primary care physician, you might have the option to get a free circulatory strain screening at a well-being asset in reasonable or different areas locally. You can likewise discover machines in certain stores that will quantify your pulse free of charge. Public circulatory strain machines, like those found in drugstores, may give supportive data about your pulse. However, they may have a few impediments. The precision of these machines relies upon a few variables, for example, a right sleeve size and legitimate utilization of the machines. Ask your primary care physician for counsel on utilizing public circulatory strain machines. Causes. There are two sorts of hypertension. Essential, fundamental, hypertension. For most grown-ups, there's no recognizable reason for hypertension. This kind of hypertension, called essential, fundamental, hypertension, will in general grow bit by bit over numerous years. Auxiliary hypertension. A few groups have hypertension brought about by a hidden condition. This kind of hypertension, called optional hypertension, will in general show up out of nowhere and cause more severe hypertension than does essential hypertension. Different conditions and meds can prompt optional hypertension, including obstructive rest apnea, kidney infection, adrenal organ tumors, thyroid issues. Certain imperfections you're brought into the world with, intrinsic in veins. Certain meds, for example, anti-conception medication pills, cold cures, decongestants, over-the-counter agony relievers and some physician-endorsed drugs. Illicit medications, like cocaine and amphetamines. Remember to like, subscribe and share.